This video is my coverage of the film Frankie and Alice, directed by Jeffrey Sachs and starring Halle Berry. What we're going to be focusing on with this film is the way in which writers and directors typically present dissociative identity disorder. In many ways, the film Frankie and Alice is a departure from what's typical in Hollywood films. It's a presentation that is in some ways largely accurate, and the director hasn't really used dissociative identity disorder itself as a plot device. It's an aspect of the main character, but he doesn't fall into the trap of using, for example, casted characters to represent alter personalities. And I'll get into why that's significant as we go forward. But a few introductory remarks about the film. Halle Berry was interviewed by Katrina Gay and Courtney Ryers for the National Alliance on Mental Illness when the film came out, because the film was being presented to potential audiences as a more accurate portrayal of dissociative identity disorder than what is typical. And in responding to a question asking her why she was attracted to the role, Halle Berry stated that people who live with mental illness often struggle, others often look down on them or have negative opinions of them. Hopefully, this film will do some good. I'm happy that the film is being released and hope that it promotes the importance of compassion for others, that it helps educate the public. She also notes that the story of Frankie is based on a true story of a real person. There are some significant deviations in terms of plot and such that to drive the story for cinema, but she met the real person, the real Frankie, and got to learn about her particular struggle and her challenges, and she felt that that would be something interesting for her as an actor to be able to work with. Preparing for the role, she actually met with the real character, the real person on whom the character of Frankie is based. She states that it helped her to kind of wrap herself around that real person's experience, and by learning her story, she was able to prepare for the role. She also did some reading to prepare, learning about dissociative identity disorder, especially from first-person narratives. So what she was really trying to do was not rely on the stereotypes that are associated with multiple personality or DID that she, like all of us, were familiar with, but instead wanted to get real information. All right, so let's get some grounding in what dissociation is. As I usually do in my weekly coverage of films, I don't want to steal the spotlight from those of you who have disorder cards for this film, but I do want to give you some perspective and some basic information about the disorders that are relevant to the film. Dissociation is described, and the text that I'm referring to here is by Wedding, Nimick, and Boyd. It's a well-known text that looks at the way in which you can use film to educate about mental illnesses and clinical psychology. It's a text that isn't directly, it doesn't directly emphasize stigma as much as other kinds of reading that I tend to have you look at. But they do give me a way of providing you with some basic information about dissociation and what it is, because we often find it to be an experience that, while common in normal parameters, is hard for us to describe. So first off, what do we mean by dissociation? Dissociation is when you experience an alteration in your conscious experience of the world or of self that comes with the sense that there's something changing in your core identity. Now, I want to normalize dissociation. We all dissociate to one degree or another. It's you have to make a distinction, though, between normal adaptive dissociative experiences and maladaptive dissociative experiences. So in dissociation, especially if you're talking about dissociation that involves identity change, and it's going to be hard for you if you're not a student of psychology or you've not had an abnormal psych class, to kind of separate yourself from all of the multiple personality characters you've ever been exposed to in media, because we get these over-the-top kind of dramatizations of a dissociative shift in identity that has much more to do with science fiction than it does with reality. That said, Wedding and his colleagues talk about dissociation where information that would normally be integrated and connected become separated. So you can think of how if a person has had some sort of dramatic negative experience, something with a real powerful emotional valence to it, if that emotionality is too overwhelming at a given point in time, it may be helpful, functional even, for the person to be able to kind of box up that emotional experience and segment it off from who they are in their day-to-day life. And in a way, that's what dissociation does for us. It's like having the emotional capacity to take overwhelming emotions, partition them off, and keep them from overwhelming us in the moment. Now, we all have this capacity to one degree or another. We use it for adaptive coping, where you have a bad experience or you have a difficult challenge, and it is kind of overwhelming, but you're able to push it to the side, sometimes temporarily, sometimes more than that, in order to continue with things that you need to be doing day to day. So that said, dissociation is often is often described by clinicians, psychiatrists as a defense mechanism, and in many ways it can be a healthy adaptation to keeping ourselves feeling safer and more in control in the face of very frightening or painful events. So there's a line at some point, and it's a fuzzy line. It's a line that's incredibly difficult to describe, where dissociation can become so profound, though, that it becomes pathological. And there are other forms of dissociation than just dissociation impacting identity. There are experiences of derealization, for example, where the person feels a strong sense of unreality. And that's a type of dissociative experience that is connected sometimes to PTSD. As I mentioned before, there's a gigantic typo. Sorry about that. What dissociation does in an adaptive sense is kind of separate you from the overwhelming fear and pain or other kinds of emotional experiences that come with trauma. And why would it impact identity? Well, the way I explain this to myself is that we tend to, as we live our lives, events happen to us, and in order to have a coherent sense of who we are, we tend to integrate those experiences into our self-concept. And by doing so, what we're doing is constantly kind of rewriting our own story. Now, what if something really dramatically painful or overwhelming happens to you? Then it becomes difficult to integrate that information, that experience, into that overall sense of self. And if it's just too overwhelming, or say if you're too young to make sense of the experience at the time, what the mind may do is segment off those experiences and allow another kind of identity structure to deal with it, or to house it, if you will. Now, as Wedding puts it, dissociative experiences can be put on a continuum. As I've said before, we do minor versions of dissociation all the time. It's a normal adaptive human capacity to kind of separate yourself from experiences that you're having in the moment such that they can't harm you emotionally. And other types of dissociative experiences are very positive and allow us to explore and expand and kind of experiment with who we are. So your Wedding gives the example of daydreaming. It's a very mild dissociative experience where you're not experiencing a complete kind of segmentation or an alteration in your identity, but you're able to kind of play roles or imagine yourself transformed in those mental events. So that's on the mild end and the very adaptive and healthy end. Dissociation can become pathological, though, when it interferes with functioning, when it produces symptoms such as anxiety and depression that interfere with successful adjustment to life. Dissociative identity disorder is one of several dissociative disorders in the DSM that can be described as pathological. The research is problematic on DID primarily because it is, well, there are two broad issues. Number one, it's very rare. I had a clinician friend of mine who we were talking about, her experiences being a clinician, and she noted that she had, after decades of practice, a client with dissociative identity disorder, and she described it as being like the holy grail of psychiatric diagnoses. In comparison to, say, anxiety disorders or depression, for example, which are fairly common, dissociative identity disorder is extraordinarily rare. Now, as TV and movie watchers, you might have the expectation that it is far more common than it actually is. So the research is difficult because of that, because there just isn't enough of a population to draw firm or reliable conclusions. In addition, the disorder is controversial for some reasons that I'll touch on here in a moment. The controversy in the mental health community comes from a number of different sources. There are people, both inside and out of the mental health community, who express doubt or overt disbelief that dissociative identity disorder is a thing. So you may have heard that, multiple personalities is a myth, that it's something that was fraudulently created out of, mistaken theories or whatever. And this idea that there's no such thing as dissociative experiences, or dissociative identity disorder in particular, in part it stems from some dubious behaviors on the part of some psychiatrists historically, who may have used manipulative methods with their clients, with their patients, in order to basically convince their clients that they were experiencing these dissociative states. And there's been a lot made of those cases, in particular because in some of these cases, the connection to trauma was in the form of getting people to recover memories of sexual abuse at the hands of relatives or other close others. And then there were, just a lot of backlash about inducing false memories. And there's reliable research that we are, in fact, capable of inducing false memories with the right experimental techniques. So the whole conversation about dissociative identity disorder kind of got conflated with these arguments about false memory induction. And it remains controversial to this day because we can't really, without the disorder being more common, we can't really do the kind of research that's necessary to understand it fully and to really fight back against those who doubt its existence. Now, all of that, putting all of that on the table, I will say that there is significant clinical data that suggests that, number one, dissociation is a thing. It is a real experience, and it in fact can have pathological consequences in many cases. Clinical data also shows that dissociative experiences are more likely to be pathological when the person has experienced significant trauma. And then finally, there are enough carefully documented cases that don't involve some of the memory induction, like past age regression types of techniques. So using more reliable interviewing techniques that don't involve leading questions or other kinds of techniques that would induce false memory construction. There's enough reliable case data to suggest that significant disturbance of identity is possible and may manifest itself in the form of these separate identities in people. The controversy is going to remain. I think I've mentioned to some of you who are thinking about doing a DID film for your film analysis essay, if you want to start a fight at a clinical conference, drop dissociative identity disorder and just see what happens. Because there are true believers on both sides and not a lot of scientific evidence that can help to resolve the debate. Now, with the best evidence that we do have available to us, dissociation, as I've already said, dissociation by itself is not inherently pathological because we all do it. We all dissociate to some degree and for more than one reason, not just as a response to trauma. If dissociative states, whatever they are, whether it's derealization or alteration in identity, if what it results in is distress and impairment of functioning, then it's a psychological problem and will respond to therapy. So dissociative identity disorder, which used to be called multiple personality disorder, just to summarize here, it is very, very rare and includes both changes in memory. So one of the first signs that someone has DID is often the fact that they have been seen doing and saying things, engaging in activities, but they don't remember having done so, and that others have reported that they were acting and interacting using sometimes a different name, a different style of speaking, different style of dress in these other events, but they have no memory of it. So those sorts of events, though it's rare, they have been written about in the clinical literature fairly consistently. The essential feature, as Wenning puts it, is that you have at least two, more frequently more than that, distinct identities. They don't necessarily have different names. They may have different names. They may be the person, the core identity at different ages. They may have different sexes. They may have different gender identities, they may not. There's with the cases that are available, there is some variability in terms of how DID is presented. One other distinct feature is the alteration in memory, where you have you're amnestic, or you don't have a memory for what one or more of the personalities is doing. And this is something that's often violated in film in one way or another, where it's often a useful plot device for filmmakers to have an identity that knows all, because that can be manipulated for the purposes of driving the plot, to have the one identity that knows everything. Not all people who experience DID have some kind of all-knowing alter, but that tends to be more useful in film to present it that way. The theory that has the most weight at the current time is that DID is wrapped together with other kinds of post-traumatic experiences. So from the very earliest days when psychiatrists, and there was discussion of a DID-like syndrome at the time Freud was active and writing. He didn't talk about it directly himself, but there were conversations about these kinds of experiences at the time. The theory that has kind of stuck is that particularly when children are traumatized, since they are children and they are not prepared for a dramatically traumatic experience, what the child may be forced to do as a protective measure is to put that experience aside, use their vivid imagination to construct an alter identity that can cope, until later in life, when they are mature enough, they are old enough, that with assistance they could reintegrate those ideas. Now, that's another part of the history of dissociative identity disorder that's difficult and controversial, because we don't have enough data to really draw conclusions about whether that post-traumatic narrative is the only way that dissociative identity disorder arises across the life course. There are cases in the literature of DID arising in adulthood after an adult trauma. So it's difficult to draw really broad conclusions with reliability based on the data that we have currently. Now, dissociative identity disorder, as Wedding describes it, has been used by filmmakers from as early as film arose. Even in some of the earliest talking pictures, you had either overtly described DID characters, or in retrospect you can look at them and know that what you're dealing with is a dissociative identity film. Now, Wedding and his colleagues, they go over a number of films that involve DID characters, and again, the Wedding text is designed to use film to teach you something about dissociative identity disorder. They raise a film called Peacock, which is well worth your time if you are a film buff and you're interested in these things. It's a 2010 film starring Cillian Murphy, an Irish actor who plays male and female characters, a main identity and an alter identity that is presenting as female. The film does provide some useful things like a character analysis and a fairly accurate depiction of dissociative disorder, and describing, including the trauma at the origins of the person's changes in identity. As often happens, though, with the storyline, they move in the direction pretty dramatically and graphically of having the main character, become quite violent. And this tends, as Wedding puts it, to push this narrative that people with mental illnesses are violent, and specifically that people with dissociative identity disorder are violent. So this stereotype that shows up even in a good film, that does give you, for most of the film, a pretty accurate take on what DID is. This story narrative of the DID person devolving into homicidal behavior is ubiquitous. Now, the film I'm having you watch really departs from that. It doesn't fall into that narrative trap of having someone with dissociative identity disorder have a hidden alter that is basically a psychopathic murderer. But that's the real common narrative, is that one. Now, Fight Club, which is a film that Wedding describes as a more typical way in which dissociative identity disorder is presented to us in film. You may be familiar with the film. It came out in 1999, directed by David Fincher. I used to use this film in class when I first started teaching the class. It's a movie that sparks a lot of strong feelings. There's still a cult fandom out there, with active discussions going on about both the novel and the film, including lots of lore and fan fiction, just in discussing it. So people can get kind of uptight when you criticize the film. I'm only going to say that, this is a very typical DID film. You have a character who is struggling with some personal issues in some really weird ways. He's described as meeting a person called Tyler Durden, who he is eventually, you find out in the great big twist in the film, you come to realize that he is actually the narrator's alter ego. In many of the DID films, especially films that follow the common narrative of devolving into violence, you have a casted character who plays the main character's alter. And they're shown in all kinds of conversations and altercations, and these are physical in nature. Well, that violates, what we know about DID. More often than not, the alters are, if not completely unaware of one another, they are aware in distant forms. They do not hallucinate their alters and have encounters with them. Most people with DID do report that they may hear the voice of their alters, but it's not as if they are having an ongoing relationship that includes conversations and physical altercations. So this pushes the myth that people with DID hallucinate, and it also enhances the confusion that people often have between dissociative identity disorder and schizophrenia. So when writers and filmmakers decide, I'm going to cast a character, so you've got Ed Norton and Brad Pitt. Brad Pitt is Ed Norton's alter personality, but by casting a character and having that character be the diametric opposite of the main character, he's flamboyant, he's exciting, he's sexual, he can prance around in a woman's nightgown and still be seen as hot in the film. So he's everything that Ed Norton's character isn't, and that's another kind of plot narrative device that writers of DID films often use, particularly with male leads. You'll have kind of a meek, struggling character, and his alter personality is like uber masculine and strong and pushes boundaries and is demanding. So in some ways, writers, especially if they're dealing with a DID character that is male, will tend to emasculate the core identity and have an alter that's rising to the surface who is very, very, very masculine and very, in many cases, violent. In the film, the two, the alter and the main personality are shown physically fighting each other. And there is a strong theme of trying to re-empower disenfranchised men. And in the film, you're mostly looking at white men, so that's kind of a part of the narrative as well. DID in films like Fight Club, it's used as a plot device. You get the big twist toward the end of the film where you realize that the narrator of the film, in fact, has this alter identity, and the alter identity has been engaging in all kinds of violent mayhem without the narrator's knowledge. And then eventually he puts two and two together. He shoots himself in the face in order to rid himself of the alter identity, which, newsflash, you can't shoot yourself in the face as a treatment for dissociative identity disorder. All you will end up with is, dead. So the portrayal in films like Fight Club or Split or any number of other films in this genre is not accurate, and the protagonist of the film is quite violent, so it falls into the same trap that even a very good film like Peacock does. In his review, when Split came out, that's the M. Night Shyamalan film from 2017, and there are a couple of you who are, at least a couple of you, who are planning on writing about Split for your film analysis. When the film came out, Steve Rose wrote a piece for The Guardian that I think does a good job of talking about why filmmakers and film goers tend to do a disservice to dissociative identity disorder and the people who experience it in real life. Rose notes that there's a long cinematic history of these kinds of characters. He notes that Psycho, the 1960 Hitchcock classic, which, again, if you are really into film and you've never seen Psycho, it's a classic for a reason. As Rose describes it, he sees it as a horror masterpiece. Essentially, it's a murder story, a fairly typical now, but at the time it was somewhat innovative as a murder narrative, and Hitchcock, like others before him, used multiple personalities as a plot twist. And here's another case where you have a meek, kind of effeminate male lead who, as the film unfolds, you become aware that he's a murderer, and he's a murderer of women, and he dresses as his dead mother who he has murdered in order to commit the crimes. And the Psycho narrative has kind of set the tone for other DID films going forward. So not necessarily starting with Psycho, but certainly building from that point. Filmmakers have long hooked DID to horror. And the basic narrative is that you have a core character who is likable, is in some ways pleasant, seems to be normal, but has issues. So it has things that they can't explain in their life, and the real horror unfolds when you realize that they are not who they seem to be, at least not part of the time. And these alter identities are doing very bad things. And sometimes the story as it unfolds involves the core character overcoming the horrifying alters, but more often succumbing to them. So these themes, it's not always identified as a mental illness. sometimes the DID type things of having alter identities is presented to you in a science fiction way or in the context of demon possession. We have tons of these narratives where you have people possessed by devils or gods, people who are transformed from human to animal, such as werewolves or vampires. Those narratives have been with us since the beginning of humanity, this idea of being transformed into something uncontrollable and potentially evil and dangerous, something murderous. Human beings seem to adore those sorts of horror stories. In a modern environment, dissociative identity disorder, given the stigma associated with mental illness in general, it just becomes another kind of possession story or a demon transformation story. And that's unfortunate. Rose goes on to talk about films like Fight Club that I've just mentioned and Split as potentially damaging because they stigmatized. He argues that many DID films are based on real people. The film that I'm having you watch, Frankie and Alice, is one of those. Three Faces of Eve and Civil are more controversial true life stories, primarily because in both cases you have counter narratives that evolved long after the films were produced, talking about the real life people having been exploited by some combination of family members, but more often their care providers, their psychiatrists, for example. So many of these films are, in fact, connected to real stories, and the real stories are often convoluted and hard to document. And on primetime television, we have had in recent years some examples of primetime programs. They are both of these shows were cable shows. United States of Terror and Mr. Robot. United States of Terror, they actually did work with consultants. Some were mental health providers, and one of their consultants is a well-known blogger who writes about her experiences with dissociative identity disorder. United States of Terror was applauded for being more authentic and being largely positive in its portrayal, but was criticized for frequently being, quote, over the top, being over dramatized. Mr. Robot was a dystopian series. I found it very enjoyable, and was tricked, at least until halfway through season 1, by the hidden plot twist of the main character's alter identity. With Mr. Robot, there are positives. There are ways in which the performance and the writing are accurate, that there's a trauma focus, there are real portrayals of just, really painful struggle on the part of the main character. But again, you have the writers eventually fall for the trap of using a casted character as the alter identity, having the person devolve into a place where really vivid violence is committed. At the same time, though, you have some, in many ways, sympathetic character who's just shown really struggling with some very difficult to cope with symptoms. For Rose, though, his conclusion was, quote, "Let's be honest, though, promoting greater understanding of mental illness has never been the priority for the entertainment industry." And when it comes to films about DID, I have to agree. Most filmmakers and writers appear to be attracted to DID for one reason only, and that is to have a really handy shortcut for creating an interesting plot twist. Now I'm going to pause here. This will be the end of part 1 of our Frankie and Alice lecture, we'll come back and talk about the film itself.